In recent months, I've been reading more about how artificial intelligence is being used in cardiac ultrasound or echocardiogram and how it's able to take a lot of the images on its own. And so I was wondering if it's advanced to the point that people could get echocardiogram at home with POCUS or point of care ultrasound. And I did find one study where they trained visiting nurses or home nurses to visit people at home and do cardiac ultrasounds. And now they don't read the results. A cardiologist would still read the results remotely. But that's very beneficial in that, if that becomes more of a thing, if the artificial intelligence develops to that point, that you can get ultrasounds at home, especially for people who don't have cardiologist offices in their town or are not able to get to the office easily. They could get these tests at home. And eventually, I did even see one study where they were training people who have no healthcare background to do these POCUS or point of care ultrasound tests on themselves at home. So that was of their abdomen and not of their heart. But and they're not going to read the you're not going to read the results of your own test. You would still go remotely to somebody else, a doctor, to read. But eventually, it's similar to how you take your own blood pressure at home. With the help of artificial intelligence, you may be able to do your own ultrasound tests at home. And that would be exciting, for people who are not able to get to the doctor's office, or even people with a history of cardiomyopathies and congestive heart failure. If they want to do a quick check to see if there's anything that's changed, they'd be able to do the ultrasound test at home if they had the device for it. It's gotten more and more inexpensive, the actual devices, but the main thing is knowing how to use it. And so with artificial intelligence, I think pretty soon in the next couple of years, it's probably going to be able to take all the images on its own, and you would just have to hold it up to yourself, to your chest or to your abdomen or whatever, and it's probably going to be able to do a lot of the rest on its own.